Can hyperbaric help people suffering from migraines? That's a question I get pretty often. If you get migraines, you've probably already tried so many different things to help find relief. Hyperbaric oxygen can help, but maybe not in the way that everybody expects. Hi, I'm Dr. Jason Saunders, and I've been practicing hyperbaric medicine for over 20 years. And in that time, I've worked with hundreds of patients who suffer from migraines. And in that time, I've been able to work through a number of different scenarios to help us generate a process to go through to help us develop a trial run of hyperbaric to see if it's a good fit for a patient, and then a more long-term protocol in order to find relief and then sustain that relief over time for those that it's a good fit for. So what is a migraine? A migraine is a condition affecting the brain and the nervous system. It typically presents as a moderate to severe headache and is usually accompanied by nausea, potentially vomiting, or other sensory-related sensitivities. There may even be an aura. Now, you can have migraines with or without an aura, and if you have migraines with an aura, often that will present as visual disturbances like flashing lights or a blind spot potentially, all of which can be incredibly debilitating and really have a negative impact on quality of life. There are so many other indications that we've covered on this channel where hyperbaric is almost guaranteed to have a positive impact. This isn't really one of those, though in my experience, the overwhelming majority of people still do find relief. But what's the connection? How might hyperbaric actually help somebody with migraines? Well, there are a number of underlying causes for what triggered the migraine in the first place. Inflammation, changes in blood flow, toxicity, or even significant hormone fluctuations. Sometimes the migraine is also triggered by musculoskeletal issues, specifically around the head and the neck. Depending on which underlying issue you're experiencing really determines how likely it is that hyperbaric may help you. So let's cover a few of these more common triggers. If you're experiencing migraines due to chronically elevated levels of inflammation, well, we know for sure that hyperbaric reduces that. Hyperbaric has been long studied on its effect of reducing inflammatory cytokines, increasing anti-inflammatory cytokines, as well as helping to balance the different arms of the immune system. So if your trigger is around inflammation, the likelihood that hyperbaric is going to help is very high. What if your underlying issue happens to be related to blood flow to the brain? Well, we know that hyperbaric oxygen can help improve blood flow. And of course, as a result of the hyperbaric experience, we're dissolving exponential levels of oxygen inside the liquid portion of the blood. So our ability to deliver oxygen to the brain is exponentially higher in that hyperbaric environment than it is outside the hyperbaric chamber. As we drive better blood flow and drive higher levels of oxygen, we can improve the perfusion to the brain tissue, helping to improve brain function. Perhaps your underlying issue has more to do with toxicity. Well, we also know that hyperbaric oxygen actually improves our detox pathways, helping to reduce that toxin burden and its effect on our body, particularly the brain and the nervous system. If your issues are more surrounded by hormone imbalance, we also know that hyperbaric can help balance your hormones and create hormonal stability. And lastly, if the triggers happen to be more musculoskeletal, as a result of musculoskeletal issues, that will typically create localized inflammation in the area. And again, we know that hyperbaric will help to reduce all of that inflammation. That being said, inside these different triggers and categories of what might be causing the migraine, most likely hyperbaric should not be utilized alone. In other words, if you have inflammatory issues, there might be additional anti-inflammatory steps that you should take that will help hyperbaric work even better. If you're exposed to higher levels of toxicity and that's your main trigger, having other strategies or doing other therapies to help reduce the burden of those toxins is probably going to be critical for long-term relief. While hyperbaric does help to balance your hormones, again, there could be additional therapies or additional steps that need to be taken to ensure that you're able to help maintain a more balanced hormonal system for the long term. And if your issues are musculoskeletal, also making sure that the musculoskeletal system is being worked on to help alleviate the source of that inflammation is going to be necessary in order for you to get the highest impact and the longest term relief. I say all that just to make sure that you understand that hyperbaric oxygen is not a direct treatment for migraines. It's not the cure for migraines. However, one common denominator amongst most of these triggers and underlying causes happens to be reduced blood flow, reduced oxygen getting to the brain, and elevated levels of inflammation. So hyperbaric does seem to help so many people with migraines regardless of what that trigger happens to be. We will get right back to that video, but real quick, there are a number of rules and regulations and best practices that you need to know in order to be safe and compliant and run your practice accordingly. If you're not sure that you've got all your bases covered, we've created a free checklist for you that maps out everything that you need to become compliant inside the hyperbaric industry. You can grab that checklist for free by clicking the link in the description below. And now back to our video. When a patient comes into our office with migraines looking for relief, the first thing I'm really looking for is a pattern to their migraines. Because we don't always know if hyperbaric is definitively going to help, we start by trying to find a pattern. Because patients diagnosed with migraines present so differently, we need to figure out if a pattern even exists around the intensity, the frequency, or the duration of the migraines that they're experiencing. We're looking for when is the best time to introduce hyperbaric to see if we're going to have some type of impact on their symptom pattern. Some patients may come in saying, I have 3 migraines a month, or I have 2 migraines a week very consistently. And inside that number of migraines that I have on this particular time basis, the intensity is 9 out of 10 each time I have a migraine, and they last for 24 to 36 hours. Okay, now we have an intensity, a frequency, and a duration. Perhaps another patient comes in and they have hormonal triggered migraines, in which case they could say something like 3 days or 5 days before my cycle, I'm guaranteed to have a migraine that's going to last 3 days. It's a 9 out of 10 and it happens every month. Okay, at least we have a pattern. Here's the intensity, here's the frequency, here's the duration. That's the kind of information I'm looking for to say, okay, let's start hyperbaric at this moment and then proceed for a few weeks to see if we're moving any one of those needles. A typical initial exposure to hyperbaric has to be at least 2 to 3 weeks just to find out inside their pattern if intensity, frequency, or duration has any change whatsoever. And quite honestly, a change in any one of those, let alone in all of them, would be enough to say, yes, we should move forward. So perhaps that patient has 2 migraines a week, very consistently, they're a 9 out of 10, and they last 36 hours each time they have one. And so we begin a course of hyperbaric. We're doing it a few times a week for 2 to 3 weeks. And as a result, it's still a 9 out of 10. It's still happening twice a week, but maybe it only lasts 18 to 20 hours. Okay, one of those needles moved. Or they're still happening twice a week. They still last 36 hours, but it's really only a 6 out of 10. Great, we moved a needle. That's what I'm looking for the initial course of care. If we do a 3-week term of hyperbaric and their symptom pattern is identically the same, no change in intensity, no change in frequency, no change in duration, it's probably not something I'm going to continue to recommend. I might take a step back, reassess their case, and look for other areas to intervene before trying hyperbaric again. If, however, we start that initial course of care and we do move one of those needles, or maybe 2 or all 3 of those different needles, then hyperbaric is definitely something I'm going to recommend that we continue to do. Especially if migraines are pretty severe, they've been very chronic, they've been going on for a long period of time, and they're debilitating and creating massive negative quality of life, I'm going to want to do at least 30 to 40 hours of hyperbaric as their full initial program. Inside the first 2 to 3 weeks, we're just trying to say, did we move a needle? And for the next 4 to 6 weeks, we're continuing to move that needle and seeing improvements in their quality of life. But as I said earlier, hyperbaric's not the cure for migraines. So there are a number of triggers that might be inside this person's life that are unable to change or are yet to be discovered. In which case, some amount of maintenance or ongoing hyperbaric could be necessary in order to keep those improvements once we reach them. It would be very common to do 3 to 5 sessions a week for the first 8 to 12 weeks in order to do that first 40 hours. Assuming we get to a place where the patient is happy and having a pretty significant reduction in their symptoms, we're then going to start spreading those sessions out, trying to get to a place where what's the least amount of hyperbaric they need to do in order to maintain the improvements that we got during that initial protocol. For some patients, that could be once or twice a week. And for others, it might only be once or twice a month. That varies dramatically case by case. Of course, any additional work that this person is doing to help reduce their other triggers, like reducing their overall inflammatory response, reducing their toxin burden over time, that's all going to make whatever we're doing on the hyperbaric side work even better. And as a result, we'll probably need even less maintenance over time. One of the great things about hyperbaric is it's incredibly benign. It's incredibly safe. So if you suffer from migraines and you're wondering if it's going to help, I would have to say that it's certainly worth a try. With the correct program of care inside of the right equipment, with an office who knows how to handle cases like yours, there's really no reason not to try it. Doing 2 to 3 weeks of treatment just to see if it's moving those needles for you and improving your quality of life is absolutely worth it, in my opinion. And if you happen to be in the majority where hyperbaric is moving those needles and helping to reduce your symptoms, following through with that longer course of care, finding a way through that maintenance program so that you can have a long-term response that's favorable, getting back to the life that you really wanted and deserve, is certainly worth the time and financial investment of what it would take to get hyperbaric to work for you. Hopefully this video helps you better understand whether or not hyperbaric may help you or someone you know who's suffering from migraines. As I said earlier, the timing of when to utilize hyperbaric and the program to utilize hyperbaric is going to vary dramatically case by case. So make sure that you're working with somebody who understands these concepts and is able to work through that process with you. If you're unsure and you're wanting to reach out to us, please feel free to do so. Contact our office and we can set up a time to have a conversation around that. Thanks again for your time. I hope this was helpful. We'll see you on the next video.